Hi, this is Dr. Jason Dulac coming to you from my office in Springfield, Virginia. In my office, I get a lot of questions about crowns today. I hope to answer some of those questions for you. The one thing about my office, we do have a same-day crown machine in the office. So at many offices, at least 85% of them, you'd need to come in one day, have the tooth prepared and get a temporary, and then come back a separate visit for the crown. At my office, we have a couple of different same-day crown machines. So we'll scan the tooth that day. You'll get your crown made in the office that day, and you'll get it delivered that day. So there won't be a temporary. You won't have to come back for a second visit, and it's the same high quality ceramic that you get at the lab. Crowns are a cap for the tooth. They go on the tooth. They're used when a cavity's usually more than half of the tooth or a corner of the tooth is taken out. A filling's really like a patch for a tooth. So if you were going beyond that, a crown is harder, stronger, and longer lasting than a filling by about 3 times. So anytime I don't think I can get a filling in the tooth, the next step would be a crown. Crowns are also needed for any posterior teeth that have had root canals or endodontic therapy. If you have questions about what that is, I've got another video on that. And there are a lot of different types of crowns that have been done over the years. You know, in the 70s, it was gold or porcelain fused to metal. So you had a metal base with porcelain stacked on top of it. Nowadays, the last 10 years, huge advancement in ceramics for almost getting into good printed materials as well. So most crowns nowadays are going to be a ceramic. The two most common being zirconia and lithium disilicate, which is a reinforced glass. So cosmetic, strong, nothing's going to be exactly the same as a tooth, but we're getting quite close with a number of different materials. And we do have 2 of those same day crown machines to make those 2 most common ceramic crowns in the office for you. Crown starts, if you never have one, crown starts about the same way as a filling. We get you numb, we take out the decay, we take out the old filling if there's one in there. Then we shape the tooth about 1 millimeter to 1.5 millimeters off the side. So it's basically an enamel replacement for a tooth. So enamel's the outer surface of the tooth. So just imagine taking that off and a new top being made for the tooth. It could get decay again at the edges. Nothing's going to last forever. Nothing's going to 100%, keep the tooth from having a problem, but it does last 3 times longer than a filling. It's a lot stronger than a filling. And it's what we need to do if a certain amount of the tooth has been compromised to the point that we can't do a filling anymore. They should look like natural teeth. Teeth are unique in different layers. They reflect and transmit light different ways. Nothing's going to be your tooth, but crowns are getting very close to mimicking the natural tooth structure enamel, and with custom glazing and things like that from the lab, you can get to the point where you're talking from about this distance. No one's going to know you had a crown except for me and you. You take care of a crown just like you take care of a normal tooth. So brush, floss normally, eat normally, hygienist cleans it like normal. There's no restrictions after the procedure. How long would you expect a crown to last? About 3 times longer than fillings. Average filling in the United States only lasts 2 or 3 years. Average crown 5 to 7. That being said, at my office, if you're taking care of things well, I'd like to see you get at least 3 times longer than that out of that. So a good 15 years plus. I have patients who, not my crowns because I've been practicing for 15 years, but I have patients who crowns have been in their mouths for 30 years. So if you take care of it well, it's just like anything else. You take care of it well, it's going to last. Does dental insurance cover crowns? Yes, absolutely. They are the standard of care for root canal treated teeth if more than half the tooth is gone or if a corner of the tooth is missing. So if that's the case and you have insurance, they will cover the crown. We have cameras in the office in addition to the x-rays to submit with the claim to show the insurance companies what's going on. We're always going to help you maximize your dental benefit. It is a medically necessary procedure, and it's the best thing for the tooth in certain instances, and the insurance company knows that and they'll pay for it. If you have questions about a crown, especially if you're interested more in our same day crown machine at the office, if your dentist doesn't do that or doesn't have that, please give us a call, 703-451-4500 or dulacdds.com. There's a lot more information about the CEREC is the name of the crown machine, same day crowns on my website, and I have some different videos on that as well.